Day 2 of nurses at Rochester General Hospital taking to the picket line after union negotiations fell through at the facility. What they're asking for is better pay and adequate staffing. It's something nurses say is lacking and creating safety hazards for both staff and patients. Our coverage continues now with Christian Garzone, who was out there this evening. Christian?
Casey, hospital leaders are saying they've made efforts during all of this, saying nothing proposed or not proposed has warranted this strike. Nurses are saying, however, they need to do more. Sherry McDonald is the chief nursing officer at RGH. Due to a shortage of nurses across the area, she said all within Rochester Regional are using something called agency nurses to help fill the ranks.
Because we've had to use agency nurses, we've reduced our vacancies significantly, which makes it for safer staffing.
But tell that to those out here picketing. Those here told News 8 they can sometimes see a 3-patient to 1 nurse ratio, stressing the system.
We are technically supposed to be 1-to-1, but because of lack of staffing, most days we are doubling, or there are other people who have 3 patients. Nurse
Phoebe Sheehan says Rochester General has been refusing to work with nurses to make improvements.
The nurses union and RGH has been fighting for safe staffing for 10 months at the negotiations table now.
Another reason for the strike. Pay. RGH says they've made an effort during negotiations, adding they believe nothing has warranted this picket. They also say over the last 2 years, each nurse has received a 19% raise. But nurses rallying said that's not true. McDonald said this strike is adding up.
The money that it's costing for this strike, I'd much rather put into those nurses and into their wages and into their proposals.
McDonald said she was pleased some nurses chose to work and not strike. She also said they are working with nurses to improve conditions.
That's why we're focusing on recruiting and retaining nurses we have.
The hope is after the strike, nurses come back to the bargaining table and renegotiate. Casey, right back to you.
Christian, thank you. Nurses at Rochester General Hospital are expected to be on strike through tomorrow.